It only takes Las Cruces High School sophomore Brandon Cullum 45 minutes to strip a bike down to its parts and then completely put it back together again.
I love working with my hands. I can build a bike from the bottom up. Like, I've always been able to do it. Like, I could take the tires off, I could take the chains off, I could just do anything.
Cullum is replacing this bike's flat tyre, realigning its wheels and testing its gears and brakes. He says aside from teaching him about mechanics, bikes have given him a quality of life, allowed him to be independent, make new friends and be active.
I love popping tricks on my bike. If you go fast and you get muscles in your legs. Just a lot of things.
Like exercise?
Yeah, you have exercise, just cardio on your legs, basically.
According to the Centers for Disease Control and Prevention, the integration of biking into daily life is an ideal way to get the recommended amount of exercise. It can also address a host of health issues, including obesity, heart disease, and mental illness. But many Las Crucens are not enjoying the health benefits of biking because they can't afford bikes. As a part of a health advocacy at work in schools initiative, Cullum is developing a project to change that. It would teach kids how to repair bikes using recycled parts.
I wanted to build bikes for kids that like walk around. See, I never liked to walk around just on my feet. Like, I really liked it, but I didn't. So I was like, you know what, I'm gonna start building bikes. And like, I built me one, and like, I started seeing all these little kids walk around. And I was like, you know what, I wanna build them bikes so they wouldn't have to like walk around. And like, it'd get there faster, they would get there faster to where they need to go.
Which we acknowledged last.
This is just one of many advocacy at work projects being hatched at Las Cruces High School. New Mexico State University health policy advocate Ruben Marquez is overseeing the project. He's working to get students thinking about health issues and showing them how to affect change in their community.
Whether it's the way they look at their community, whether it's the way they look at their own health, their family's health, from a variety of outcomes, because with their project, they get to pick the health outcome, and then they look at the risk factors, then they look at the individual behaviors, then they look at the upstream causes. So them to be able to take the health outcome and trace it back to a root cause, and then develop a plan to address that root cause is monumental.
And Marquez says the most effective way to reach young people is through their friends and peers.
They understand what's interests them. They understand what interests their peers. So they are the group that can create those sorts of things.
With Marquez's guidance, Cullum is still mapping out the finer details of his bicycle mechanic project. Marquez says he hopes the impact on students like Cullum will go far beyond their projects.
My personal goals here is to inspire students to consider public health as a study or a career, or even if it's just a way that they perceive their surroundings and their own life. Because the biggest portion of this is primary prevention.
Socioeconomics.
Marquez says he hopes the initiative can address health issues in our region, especially the shortage of healthcare professionals. According to the New Mexico Department of Health, more than 40% of New Mexicans are living in a primary care health professional shortage area. For KRWG, I'm Simon Thompson.
The brakes kind of look like they don't work.